Good morning, my name is Kieran Stephenson and I'm a student nurse with the University of Sunderland. Today I'd like to talk to you about a service improvement idea which I have deemed necessary from my time spent on clinical placement. This would be using the PDSA model for service improvement. This model for improvement provides a framework for developing, testing and implementing changes leading to a positive change and improvement. Based on the scientific method and moderates the impulse to take immediate action with the wisdom of careful study. Whilst working on the endoscopy department, whilst on clinical placement, it became evident to me that several patients would arrive for the procedure ill-prepared in that they were not able to have the procedure carried out due to them taking blood thinners or anticoagulants. Now, the advice given to patients during pre-assessment and prior to the day of the procedure is to stop taking these medications up to 5 days before the procedure is due. Now, during endoscopy, the body may need to form safe clots as it's an invasive procedure, and these safe clots can help prevent bleeding as a result of the procedure. Now, taking blood thinners can exacerbate any bleeding that may occur during the procedure, and it's strongly advised that patients stop taking this medication 5 days prior. Several of these appointments were not able to be carried out because the patients either did not know that they were to stop taking the medication or they'd simply forgotten. Now, this resulted in up to 15% of appointments had been cancelled or not able to be carried out for this reason. Apart from the obvious disappointment and frustration for the patients not being able to have their procedure carried out as planned, there's also an additional strain on administration staff. It's a time-consuming process having to reschedule appointments. Often this can be up to 6 weeks waiting time, which also would have a negative impact on the patients receiving an adequate diagnosis and, if necessary, commencement of treatment. So all of these factors are both frustrating, disappointing, and also place a financial burden on the NHS in having to reschedule these appointments, and ultimately a delay in patients receiving diagnosis and treatment. The idea that I would like to suggest and put forward for these patients who are normally taking anticoagulants is that they are sent a text SMS reminder 5 days prior to their procedure. Now, the Trust ordinarily send out text alerts to all patients prior to their procedure with regards to appointment times, location, how to travel to the appointment venue. So this idea is already in place in that all patients do receive a text message, but my suggestion would be for those patients who are taking blood thinners or anticoagulants, that within the body of the text message there is also a reminder for these patients to stop taking their blood thinners 5 days prior to the appointment. Hopefully this would alleviate any wasted appointments so that once the patients arrive for the procedure on the day in question, they have already stopped taking the medication, which means that their procedure can go ahead as planned. Now, because this is already Trust policy to send out these text messages, the financial implications of this would be minimal as they are already receiving the text message. And looking at the cost overall of wasted appointments, I find that this would be a good way of saving money, and the additional cost of sending the detail in the text message would counteract the cost of any missed appointments. The PDSA service improvement model encompasses the 4 components: plan, do, study, act. The first 2 components would run alongside together, so a time period would be suggested, for example 3 months, whereby the text messages would be sent to all patients who are taking anticoagulants within this 3-month time period. Data would be collected, so the study component would be analysing the data, finding out were there still missed appointments happening despite patients being sent the text message. All of these missed appointments are collated anyway, so for example, if a patient turned up for a procedure and it wasn't carried out, this would have been logged anyway, so this would not be a new implementation. It would just be given a reason as to why the appointment wasn't able to be carried out for patients still taking anticoagulants against advice. The ACT component would be to analyse the data, find out what went right. If successful, could the bar be raised? An initial goal would be to reduce wasted appointments by 50% to see that if the text messages make a difference. If it proves successful, then this could be rolled out on a permanent basis, and also the bar could be raised to increase wasted appointment reduction by as much as 75%. This would be ongoing, and the data would have to be continually assessed. The rationale behind this PDSA service improvement is to learn as quickly as possible whether the intervention is working in this particular setting, make any adjustments accordingly to increase the desired improvement. Are patients actually receiving and responding to the text messages? Is it working, for example, in elderly patients who may be not as technologically competent as maybe younger patients? And also, if problems are identified with the original plan, then the theory could be revised to build on this learning and subsequent experiments conducted to see if it's resolved the original problem, i.e. wasted appointments due to inability to carry out the procedure for the reasons of continuing the medication. Also, it's imperative to identify if any further problems could be resolved using this and or a similar model. It's also important to ensure that the goal of the PDSA service improvement model is SMART, in that it's specific. The aim of the experiment is to reduce cancelled appointments due to the patients not being suitable to carry out the procedure due to the continued use of the medication. It's measurable in that we can look at the data. Is this working? Have there been as many cancelled appointments due to the medication non-adherence? Achievable, yes. If patients are following the advice and withdrawing the medication 5 days prior to the procedure, this is achievable and the endoscopy procedure could carry out as planned. It's relevant in that the reduction of wasted appointments is beneficial both for the patient and for the NHS in reducing wasted appointments, and it's also time-bound in that it's a realistic time frame to assess the data over a 3-month period, and this would be timely for the patient, giving them advance notice of the requirement to stop the medication. Please find accompanying this recording a slide detailing my PDSA service improvement model, which has been referenced using the Harvard referencing system. I hope you've enjoyed this short presentation. If you have any queries at all regarding my proposal, then please do not hesitate to contact me via email. Thank you.